questions? Thank you. So the recording is in progress. I do have my information on the screen for those of you that are new. For those of you that need to send questions and emails or look me up or look us up and set up classes. I also am fully bilingual. And like I said, I'm here to help and get the message to your workplaces. So this is a free webinar. But we do, of course, provide you with services that you can get quotes from us, from Veronica, and you can also reach us out via email. Reach out to us, I'm sorry. Like I said, I started this morning with a little bit more of a serious tone, a somber tone. It's just that the news are so, it's so difficult to think of what all these people are going through. So on that, to that end, I wanted to provide you guys with tools. I want to make sure that after today, you go out there and at least you have something to start looking out for the employees that have to go out in the field, etc. So what can you do? I've been getting calls as to, hey, should I be providing them with N95s? I don't have time to do medical evaluations. Should this be on a voluntary basis? And although a lot of this information is on the website, I know what happens. And what happens many times is because we're stressed out, now we have all these questions and we have to send out people out to work, and some are calling in sick or saying, I can't show up, it's very smoky, and I have some conditions, or I'm diabetic, and I've had all of these other situations going on with my medication lately. I don't want to be outdoors, or my doctor says I shouldn't be outdoors. All of these things are important to consider. And it's hard under that much stress to be Googling and researching at this point. So I prepared for you a 4-step guide that should be easy, but there's no doubt that you have to stand in front of your crews. You have to stand there and give them a chance to ask you questions. You have to do a training session, a tailgate meeting to actually go over some of these issues. So 4 steps, they're easy to understand. They'll keep you compliant, but you must get your crews together and do this today. I sent this out not yesterday, the day before I sent out a guide for all of my clients. So you're getting it 2 days later, but you're getting it. And that's what's important. If you're a client of mine, you already got it. You got it the moment the news broke out. And I just want to make sure that we go over. So my objectives for this presentation, aside from the top 10 most cited standards in California organizations, which by the way are very tightly knit with these types of issues, when things just go wrong all of a sudden and emergencies happen, you should be ready. And you will see that the reason why the IIPP continues to be the #1 most cited in California is because that lack of being prepared, that ineffectiveness in our written safety program. So we'll discuss some of that. Some of you are really, really good at having an updated, ready to go IIPP that means something, but some of us haven't even looked at it or read it in a while. So we'll touch on that. I want to make sure we analyze some of those risks and hazards associated with the non-compliance of this top 10 most cited. It gives you kind of guidance. This top 10 most cited session, I do it once a year just because it helps us to open our eyes as to what do we need to pay attention? What should we be paying attention? And aside from that, our own records and learning from our own history and incidents and accidents, near misses, okay? So I wanted to give you this, do this today, right? And of course, I prepared this presentation before the news and all this urgency on the fires, the wildfire started, but you will have some tips on do this today. And I know some other things will take precedence, such as what? That 4 steps that you need to take if you're having to deal with crews out there in the field. And explain some of the reasons why these particular safety standards are frequently cited. So we'll go over some of these as much as we can. Like I said, the hour always goes so quickly and I get so much information out there. Make sure you come to this once a month. We have first Friday of the month, 11 a.m. webinars. But I think there's only 2 months, March and April, that we changed the date just because some of my commitments and the center's commitments. So did you get my guide? If you didn't, maybe because you're not my standing client, I have clients that for many, many years, I mean, they've been loyal and they're out there getting all this stuff, and I am always a call away. 4 steps. So let's get into sharing that 4-step guide, because I want to make sure you guys have something, and I'll put it in an email for you guys to take a look at that. Here it is. So everybody can see this. Number one step, and you can make notes or you can later on, because you're going to receive this via email after the session. Nevertheless, if you right now have to be making changes, and just write it out. Supervisors, they need to check the air quality for the cities that the workers are at. Just focus on that. Okay, check the air quality for the cities they're at. So remember, the air is polluted with many noxious things right now, but we're worried about the PM 2.5, which is the one that will create a lot of health effects in our workers. So we want to monitor the air. Wherever they go, we monitor the air. That will give you a number, right? And we start seeing it as moderate to severe when it goes above 150 and all the way to 500. Past 500, there's something else you need to do, something entirely different, okay? People have symptoms and they don't feel well even below that level. So watch for that fact sheet that I sent out also 2 days ago regarding those that are more susceptible to smoke. You need to keep an eye out, talk to your human resources, make sure you accommodate. So telework, of course, is number one, but there's a lot of things that we cannot do while teleworking. So make sure you read this out as well. I sent you guys that fact sheet, but okay, number one, supervisors, monitor the air, right? And hold a tailgate meeting, get everybody together to go over 2 things. First of all, I have Appendix B, which is part of the regulation, but because it's so wordy, et cetera, I just kind of copied, pasted it, and modified it in a Word document so you can print it out and give it to your supervisors today so they can give it a quick read and see what's required per the regulation for them to discuss. And the first thing they're going to discuss is symptoms, right? They're going to talk about what happens to your health and, you know, the coughing, the wheezing, and how if you have certain conditions, you may be more susceptible to this. That's the first thing they're going to discuss. Then they're going to go into, okay, so we need to communicate with each other. How do we communicate? So either by text, electronic messages, because supervisors need to be able to tell their crews, I want you to talk to me. I want to know what you're doing, if this is affecting you, if you're going to move locations. So communication is very important. And you will see that Appendix B is really easy to follow. And it starts with how do you communicate between supervisors and your crews. And then it goes after symptoms and communication. It goes into, okay, now this is what we as a company are doing to prevent you from being affected from this smoke and from these wildfires. And it starts by, you know, completely stopping work, which is not possible for all of you, but for some of you, it might be possible to take a look at those areas where you're sending workers to work at and say, you know what, we're going to cancel work for a few days in that area. Some of you, your actual locations, your facilities, your warehouses, your hotels, your golf courses where your workers need to be at are in those areas where the fires are affecting people and workers. So you need to actually start seeing, okay, we need that supply of N95s. Make sure that you have enough for those workers that are going to continue working in the areas where there is smoke. So that's step one, right? Check the air and get that Appendix B, which I'll show you in a moment. Number two, planning guidelines. So now it's about planning the work. If you take a look at the air quality during different days during different hours of the day, you will see that it changes. So it improves usually in the mornings, although it depends what happened during the night, but it does. I've seen historically that some hours in the morning are so much better. The air is so much cleaner. So move work to those early morning hours, even if you have to reschedule work, etc. Some of you manufacturers who keep, you know, those bay doors really open during the day for workers to continue their work. You are seeing it where you either have to stop work during these days or you have to ensure that workers start at a different time. So schedule the work differently. Remember, for air quality index 151 to 500, outdoor work can continue. That's what's key, but strongly encourage, and I put it in bold words, strongly encourage. So here is the thing, guys. Do not say to your workers, you're required to put on this mask. The air is bad, it's 150, look at it's in the red. You cannot say that, because the moment you say the word mandatory, then you just bought yourself a whole set of requirements, which is having an actual respiratory protection program in place, making sure that those people have been fitted in the past so that the make and model of that respirator, and I'm talking about a simple N95 mask, has been the one that fits them because of the shape of their face, etc. And workers have been trained to the extent that they know the ins and outs of wearing this respirator, from the limitations, how to store it, when to dispose of it, how to check for negative and positive seals, and all the stuff with the beard stubble and the facial hair, which is one of the things that you should be discussing right now for those that have to wear an N95 mask. I know I'm going fast, guys, because otherwise we're not going to be able to cover all of this. Remember, you're still going to get this guide, so you should be okay. And for air quality index above 500, don't send your workers out there unless it's essential or you are part of the emergency services workforce. So after 500, respirators are mandatory because that's very unhealthy air, okay? And I know I'm having even indoor office workers complain about the smoke. Well, most of the time it's because they have to drive and get out of the car and get into that office building, okay? So just make sure that you have these discussions where if they are part of this group of more susceptible people, you think of teleworking. Why do you have to have them come over to the office? Office work can continue, especially because you have filtered air systems, right? You went through this in the past during COVID. We did have a little bit of an analysis. The actual emergency regulations for COVID called for you to make an analysis of your air systems to see what kind of filters your system would accept, so that you could go and improve it all the way to MERV 13, right? But anyways, if you haven't done that, at least that if it's essential that these workers come to the office and you cannot have them do telework, just make sure the HVAC system is working and set it in the recirculation mode, because you don't want the outside air coming into your buildings. Super, super important. Okay, so step number one, well, I'm kind of repeating just to get this in your minds. Supervisors have to get Appendix B of the regulations so that they know what to talk about during these tailgate meetings. They have to do this for those crews where the air quality is what? 151 and above. Don't have them work if they are 500 or more, because then you have to have all of these things in place that you should have looked at before this whole thing with the fire started. Step number two, plan this work, right? Try and get them away from these areas where the air quality is bad. Number three, let's talk about N95 respirators, okay? Have enough for all of your field workers. If you're going to have them in areas or they're already having to go to work in those areas affected by the fires. Enough N95s. Remember, they have to be NIOSH certified. They cannot be K95s because those do not do the job. The material, they haven't been tested. That's why you cannot have anything but NIOSH certified N95s. Conduct basic training, we said. For the covering, when they wear a mask, they have to have basic training, and that's the seal check, right? So I train them on how to put them on, how to put the straps on, to the basics, guys, how to put the straps on. There's videos. You just Google OSHA N95 mask, and there's a quick video on how to do this, right? Because they have to loosen the straps a little bit so they don't break, and they keep going through N95s, right? They break. Those yellow straps, if you've had that stock of N95s in your warehouse or put away somewhere, right now that you need them, they're a little brittle. So it's good to kind of stretch them a little bit before putting them on. Otherwise, they're going to be snapping those straps and asking for more. And you want to take care of your supply right now, especially if you're a small type of business. Teach them how to do the positive and negative, which is covering the mask and just inhaling to check for the leakage. By the way, all of these seal checks and the basic training is included in Appendix B, which I sent to you a couple days ago. If not, you will receive it today. Talk to them about the limitations and the maintenance, meaning this is just for particulate matter, guys. This is not going to protect you against vapors and any other kinds of pollutants that you may be working with. document your training. Make sure that you write down the date, the time, how long you spent, who was present, the language in which you did this. So my goal is to keep you compliant, guys. And it's not just keep you compliant as an organization. We're looking out for our workers because without them, we cannot do anything, right? Notes for supervisors regarding respirators. So see, I took everything that is on the website and put it in like a synthesized form for you to follow. Number one, of course, keep a supply ready in vehicles, work areas, okay? Number two, whenever the AQI or air quality index for PM 2.5 is equal or greater to 151, but does not exceed 500, once again, provide enough respirators, strongly recommend their use, and do Appendix B of the regulation. Make sure they are NIOS certified. Whenever is more than 500, the respirators are required. You have to have a full respiratory protection program. Some of you already do. So those workers that have already been included in that program, those are the ones that are able to wear, use, and be exposed to that type of air quality because you already have them under that respiratory protection program. And here it is, my number 4. While work isn't prohibited, make sure that you postpone outdoor work, use more frequent breaks, rotate workers to reduce exposure. Those are really cool things that we can do for them. So don't have one worker doing the work at that location for the regular hours that he used to, not right now under these conditions, because remember, the California Department of Health is saying healthy individuals exposed to smoke for one day are able to recover, right? We will feel it in our throats. We're being exposed. But healthy individuals may start showing some health effects if you continue the exposure day after day after day, right? And that's healthy, strong individuals. We're not talking about children. And if you have young adults, on 18 and under, so 18-year-old workers, their lungs are developing, so you will have them being more susceptible to this. You also have adults above 65 who are also more prone to develop certain health effects or quicker health effects, right? Relocate work to areas where the air quality is better. And just another reminder about making sure that you can continue doing office work if you have your HVAC systems up and running. So this is one page. I did send you some extra links and resources, such as the groups that you should look out after because they're at high risk, and also Appendix B. It even gives you a drawing on how to put on the mask. But like I said, a quick video also works out. I hope that helps clear the air, because many of you were thinking, what should I do? People are asking me for masks. Remember, first thing is check the air quality, right? Take a look at whether or not those people asking the many questions or bringing up complaints or concerns, a lot of these things are concerns basically, that you ask, in a private setting, because health information is private information. Talk to me, what's going on with you, right? And maybe they've been on new medication or they've been asthmatic for most of their lives and you didn't know until now. Whatever it is, make sure you make accommodations. So this is a good guide for you guys. I will see, I see questions here. Let me see. Okay. So I will follow up with resources. Let me go back to sharing my PowerPoint. No questions up until right now?
There's no questions yet.
Very good. Thank you, Veronica. Okay, so can everybody see my PowerPoint?
Alba, now we do have somebody that raised their hand. I'm going to go ahead and unmute them. So Mark, yeah. Go ahead.
Mark, go ahead. Ask us your questions. We love when you guys interact.
You can also feel free to put it in the chat. Maybe there's an issue with the audio.
Not a problem. Okay, so for those of you subscribed to the Cal OSHA news releases, this was released January 7th. Safe wave exposed workers to hazardous conditions at its largest warehouse in Tracy. So this is an interesting one. And I wanted to make sure did I put it? I didn't do the link. Took a look at it because some of these issues on this news release are actually not in the top 10 most cited. So it's an interesting case, it's an interesting news release because it throws light to, the types of penalties that OSHA can actually impose on employers. Here, OSHA cited Safeway for 182,000 in proposed penalties, and now they have to defend. These are significant safety violations that put approximately 1,700 workers at risk of serious injuries at the company's warehouse in Tracy. Now, you may be thinking 182,000 for a large employer may not be a lot of money. First of all, it's a penalty. It affects not just your pocket, but it also affects your reputation. And the worst part of the equation here is the amount of fuel that it gives to third-party lawsuits, so liability issues. And that's what we want to avoid. Because all of these become public records. So remember, that's the reason why we have this webinars, because we want to make sure that we take a look at what are we not in compliance with, because it's going to create a headache for us later on. And I didn't do a link, so I'll go back to this new release for you to see the list. But just by looking at your screen, the manual material handling injuries, that's not even in the top 10 most cited. Nevertheless, whenever there's lifting, carrying, moving heavy items, etc., you should have an actual program, safe lifting or back injury prevention program, which I've been working with some of you to put one together and to create training videos and to create an actual calendar where we put in there how to report repetitive motion injuries, etc., because those are some of the most common. It's actually a third of the lost work types of injuries nationwide. And we need to get a hold of those. And so if we don't have anything in writing and we don't have effective training, we are going to miss.
I think on my end, Alba is frozen. So let's give it a minute here and see if it comes back. If folks in the chat could let me know, are they also experiencing the issue? Okay, thank you, Vernon. Yeah, thank you all for, okay. We'll let Alba know here to log back on. Thank you, Ingrid. Yeah, I'll make sure to communicate with her. Okay, I believe she's logging back on, so we'll give her a minute to do that. And for those of you who weren't here at the beginning of the announcement about how to receive your continuing education hour for being here, just make sure you fill out the evaluation link that we'll post in the chat afterwards. And for the time being, I have posted the link to the news release about the warehouse that was cited. So if you'd like to click on that, look through it as we wait for Alba to log back on, you can go ahead and do that. I'll post it again in the chat. All right, so Alba is back on. And is everything okay, Alba?
Yeah.
Great. Okay, so
Glitches. I don't know what happened there. I'm back. Yay.
great. Yeah, so I did post the news release in the chat and directed people towards that. So we'll go ahead and pick it up from there. Thank you so much.
Thank you, Veronica. You're awesome and quick on your feet. I can't share. Nevertheless, my next slide has to do with how many OSHA inspections in California, just OSHA inspections were opened, and it's divided by year. But what I wanted to show in this slide, as soon as I have access to sharing, there we go. I wanted to show you guys the types of inspections that Cal OSHA will actually do. Here it is. So I hope everybody can see Cal OSHA inspection type. So let's really focus on this. Cal OSHA historically has showed up to workplaces because of accidents and complaints at a very high rate or high number. So if you take a look at programmed inspections, because I think one of the questions was, does Cal OSHA target employers? They do. And in order to target employers, they will actually use a tool that is called a high hazard list. So depending on how your type of industry and company and establishments are classified under the North American Industry Classification System, it's a number. You can ask this number from your workers' compensation insurance. Depending on that, they will put you on a list of high hazard type of industry. That means historically, the type of industry you're in has more injuries, incidents, and even fatalities than any other type of industry. So because you're in the high hazard list, you become part of this kind of lottery. They randomly will pick from this list of employers and they'll go visit you. And I have been part of this programmed inspections. I have been hired sometimes as part of defending these types of programmed inspections. Hey, you know what? They gave me your number and OSHA showed up. What do I do? But as you can see, in 2022, the amount of programmed inspections by Cal OSHA is 1,310 versus the amount of inspections opened by Cal OSHA because of accidents and complaints. So the number is higher. So that means whenever there's an accident where someone was seriously injured, either they lost a limb, they had the tip of a finger is considered an amputation, or they ended up in the hospital and they were admitted. Cal OSHA considers that a serious injury or illness, and of course, a fatality, right? That's very, very, that's like the worst that could happen. But what I mean is serious injury or illness, there's a definition that changed a couple of years ago where it includes any permanent disfigurement, any loss of a limb, any amputation, and whenever a person is admitted to the hospital. So not for observation, not in the emergency room because of observation, but when the doctor actually says we're admitting you, this is serious enough. So those accidents trigger inspections by Cal OSHA, and that's when you are most vulnerable because of an accident, if something happens, if something bad happens. And then complaints. So who complains? Who can anybody can complain, right? It could be a member of the public, it could be a worker, it could be the wife of the worker, it could be their pastor. So complaints, that's also a high number compared to the programmed inspections, right? It's higher number than the programmed inspections. So Cal OSHA is a lot of work, and they send out inspectors on the enforcement side, because remember there's two sides to OSHA, the consultation side and the enforcement side. So Cal OSHA consultation, they have this demeanor where, hey, thank you for calling us. We want to help you out. Tell us, we want to go out there and visit you. And they're very friendly because they know that you are working towards compliance, and the service is free, right? It's something that taxpayers are paying for. And it goes from a simple call to say, hey, how do we deal right now with wildfire smoke? And they will tell you, very similar to what I told you today. And they're the experts, so they'll tell you, per the regulation, this and that. But the other side of Cal OSHA is the enforcement side. And the enforcement side, those are the guys that go out there and do these inspections, okay? And you must be ready for that, because all of us, no matter how big or small, we could be visited by Cal OSHA, either because of an accident or because of a complaint, right? So this is a good slide for that purpose. The next thing is, of course, I told you from the beginning that number one, the topmost cited in California is the Injury and Illness Prevention Program. So I'm working towards updating all of my clients' Injury and Illness Prevention Program. And for those of you that don't have one or haven't revisited for a few years, we just start from the ground up because it's the easiest thing to do. There are model programs, guys. You don't have to depend on a consultant. And why do you think my job exists? The reason why I exist is because you guys are very busy. Supervisors, lead people, human resources, risk managers. You're super busy. You need someone to come in and say, I already know this. I know where the model program is. I've worked off of this. I have it. I got it. You don't need to do anything. Let me just, meet with you, ask you some questions. Let's put it together so that it means something. So this is per Title 8 California Code of Regulations 3203. You have to have a written program that says, hey, I am company ABC. We make widgets. This is how we do safety at work. And in this program, you are going to, and we have a full class for injury and illness prevention program. We have had an 8-hour, 2-day class explaining and going over each of the elements of the IIPP so that we make it effective, because that's the most important thing of this whole matter. Is your injury and illness prevention effective, or is it something that you just wrote up to fulfill the requirement of the regulation and it doesn't jive with what you're doing out in the field or out in your facilities? Now, there's something that was added a few years ago to this requirement in this regulation, and that's that the IIPP must be explained to the workers. That's why number 3 on your screen says required explanation. So the way I'm going about this is I'm recording 10-minute videos with a quick slideshow for each of the elements of the IIPP. So my clients, after updating the IIPP, we're working together because we just put it together. We know what that IIPP looks like, and we prepare this 10-minute video where we are going to show it to newcomers, volunteers, contractors on site, and my employees, so that they know this is my IPP, this is how we do safety here, because the requirement is to have an explanation provided to the workers, right? And another thing about that is that you have to have an actual way of accessing the program. They should be able to say, hey, I would like to see this program and get a copy of it, etc. Number one, most cited. And you can see why. When OSHA shows up at your work site, the first thing they're going to ask you is, let me see your injury and illness prevention program. First document. There's actually a 1-page document request that Cal OSHA will take out from their briefcases and give it to you and say, here, we're here because of a complaint, which is why you would get visited, or we're here because of a ladder incident. Ladder accidents are so common. They're going to show up right away because they consider that a serious issue. And the first thing they're going to ask you is, where is your injury and illness prevention program? Give me a copy, right? And then the next thing right alongside is, where are your inspection records? Where are your training records? That's why when I explained to you today about wildfire smoke and what to do in 4 steps, I said to you, document what you're doing. Please document what you're doing. And I even put there what to document. Remember, I put there, make sure who's there, their signature, the time, the language, who did the training. All right. So the next thing that we have here is notable citations. So there's a case that closed in July. Whenever you're visited by OSHA, and if the citations that they proposed are high, they will put you on their website. And so, like I said, these are public records. So your company's name is posted there, and that's not good for your reputation. It's also not good for the morale of the whole culture inside your business. So this is Urbandale, California. January 2023, an employee was working as a sanitation worker on the night shift, cleaning a food manufacturing facility. The employee was cleaning the production room floor and was operating a forklift when he drove under a cook deck that had a low overhead clearance and struck the discharge pipe attached to the kettle. The collision caused over 400 gallons of approximately 170-degree Fahrenheit water. So this guy got burned to death, right? To be discharged from the kettle onto the employee into the forklift. The employee suffered extensive burn injuries, was hospitalized, and died 2 days later. When you have an effective injury and illness prevention program, you have a way of doing inspections and detecting and looking at near misses and detecting hazards. So looking for hazards as you do your inspections, and you have to schedule these inspections, and you have to not miss these inspections. So With my clients, depending on the size of the client, I may have bi-monthly inspections, monthly inspections, or quarterly inspections. And the smaller the business and the less hazardous the type of industry, we may even have biannuals, right, with me. Now, internally, you have to have your own schedule as well, because you bring me in to have that extra set of eyes to take a look at what's going on. Another one that I wanted to throw light on for this topic today is workplace violence. Workplace violence became an actual enforceable type of requirement because of Senate Bill 553 that became enforceable in June 2024. It brought a lot of analysis for my clients, for everyone else that wants to stay compliant for the well-being of the workers. Take a look at this. This happens in Half Moon Bay, California, January 23, 2023. The case is not closed yet. This is a disgruntled employee drove onto campus and walked into the greenhouse where he fired a firearm at 2 farm workers, then walked to the housing area, fired at 3 other workers. I believe now, because this is directly from the OSHA documentation, but I looked it up also in the media, and they said there were 7 people dead as a result of this incident, right? And so for those of you that are having trouble getting upper management to get you someone to be stationed at the entrance of your gate, or to set up a booth so that you have control of who's coming in at your facilities, show them these types of notable citations, because even if the amount of proposed penalties is not very high, you cannot believe the amount of third-party liability issues that this brought forth. So the brother is suing, the family is suing. I mean, it's terrible. And this is what becomes very nightmarish for our organization, and it puts you in danger, and it puts all these jobs in danger. Do this today. Walk the perimeter of your premises with your human resources director. By the way, emergency equipment like fire extinguishers, etc., is one of the top 10 most cited, which I think is such a little thing compared to this. And because this became a law in June, we're going to see more of this in the upcoming years. Walk your perimeter. Make sure you take a look at your access points, at your front desk. Do you have a visitor policy, like badges? Do they register? Do they sign at what time they came in? Review your records for past incidents, near misses. I've had issues where I go, oh yeah, I had a disgruntled employee just waiting for me right there in my office. Someone let them in all the way to my office. And, that is not good, not acceptable. That's a near miss. You have to make changes today, right now. So these are just kind of like, do this today. Those are easy fixes. Just walking the perimeter to see needs. That'll take you probably, if you do just half of the facility today, half tomorrow, just half an hour each day. Do that. Get started. That's my point. Get started. Another notable citations. This is on confined space. And this was in one of those new releases. This was when a mechanic wanted to or needed to enter a tank to spray a valve inside, and he was found unresponsive inside the permit required confined space. The confined spaces are also a huge issue. They did not make it to the top 10 most cited. And why am I bringing this to the table? Is because these are the black swan events that we're not prepared for. But when you have an effective IIPP, you start looking at things in different ways. Hey, we never took a look at our tanks as a permit required confined space, when aside from fulfilling the actual description, there's an extra hazard in that space, and our workers are getting their heads in there or half their bodies into it to, spray something or fix something. So I am showing you guys where these issues can become very problematic to you. Do this today. Find your IPP, update it, schedule that annual explanation through either a video or in person. I don't care how you do it, but just do it. Top most cited, number 2, heat illness. Heat illness became a bigger type of regulation now, because they added a different section 3395 and now 3396 with indoor heat. This brings a different face to heat illness, because for those of you that were worried about heat only during the summer months, now this throws it at your face saying, hey, we got to worry about heat all year round, because even in indoor spaces, when it is not hot outside, you may have heat issues indoors. So it's an all year round type of situation with machinery, equipment, and processes. So if you haven't updated your heat illness prevention program to include indoor per the new regulation, give us a call, help us out we'll help you out to help you in return with what's going on today in regards to heat. What to do today about this? Find out if you need 1 or 2 programs. Maybe you do not have any indoor heat illness situations. Schedule time to draft these programs that become necessary. And by the way, we have an emphasis program, and Cal OSHA will not retire that emphasis program, which means they can visit you because they put more of their resources towards heat illness during the summer months. But with this new regulation, it could be now brought to those processes and types of industries that they know, like foundries, breweries, etc., that they know they will find issues of heat illness. And make sure that you find out if your training is actually compliant. There's a list of things that you need to talk about. Just like I told you today about Appendix B, where I said, hey, those of you that are exposing your workers to wildfire smoke, make sure that you gather your crews and you talk about wildfire smoke and you tell them about symptoms, etc. And I copied and pasted Appendix B of the regulation, which tells you what to talk about. Same thing with heat illness. You have a set or a list of requirements and what to talk about, what to train workers on. Injury and illness prevention for construction was also top 10 most cited. Nevertheless, this one kind of flipped sides with COVID. During 2022 and 2021, we had COVID-19 and the aerosol transmissible standard as top 10 most cited, and that's because of the pandemic, right? This section only applies until February 3rd, 2025. So this emergency standard is about to expire. That doesn't mean that you say, oh, who cares about COVID anymore? No. You should still have a strong policy for the prevention of infectious diseases in your facility. Give me a call if you need to know how to do this, but I do it as part of that umbrella of communicable disease prevention. Reporting serious injuries and illnesses, it always makes it to the list because we do not have protocols. You do not have written protocols. What do I mean by that? I see that something happens, something goes wrong, and you're scrambling, right? And so if you don't have that service with me where you can call 24/7 to make that decision, the help desk decision making about an injury and illness, then you're like, what did she say? Do we need to call if it's an amputation or if it's only serious, if he's in observation, that type of thing. So we forget to call. And if you do not make the call, that carries a fine of $5,000 for not making the call to OSHA whenever you have inpatient hospitalization, permanent disfigurement, so the definition of serious injury or illness, or when you have a fatality. And even those heart attacks that you have nothing to do with, but happen and occurred at the workplace, you got to pick up the phone and call. And some of you are like, what? Is she crazy? That's a health issue. It's not my fault. But because it's something that occurred at your place of employment, you need to pick up the phone and call. Otherwise, who's going to call? Paramedics, because they're mandated reporters. So they're going to pick up the phone and call. And then OSHA says, this company didn't call us. And before, they used to give us an 8-hour window to make the call. Not anymore. So the moment these people are inpatient hospitalization status, you have to make the call to Cal OSHA. And you need to know where to call. Don't be scrambling for phone numbers. So we put it in your IIPP, where to look for that number and which region, which number, because it's the enforcement side of Cal OSHA that you need to call. Do this today. So here it is. This is part of what I put in your IIPPs, the link, the definition of serious injury or illness, because it's part of the protocols. Give them something, a cheat sheet, so that supervisors and managers can call and find out right away what to do in case of a serious injury or illness or a fatality. Lockout tagout is always in the list. Lockout tagout has to do with, this is a regulation that has to do with the servicing, the repair and maintenance of machinery and equipment that puts workers in harm's way. Why? Because machinery and equipment can restart, or it has parts that if they're not blocked appropriately or bled prior to starting repairs or maintenance, they can actually end up bursting or releasing energy and hurting individuals that are doing the repairing, the setting up, the maintenance, etc. So there is a beautiful e-tool on the Cal OSHA website, and I really invite you to take a look at that e-tool so that you know if your machinery and equipment, because there's some exemptions to the lockout tagout regulation. Take a look at whether or not you need a procedure for that machine, especially if you've seen your workers kind of, putting them up on top of wooden pallets to make repairs, etc., and you don't have a set procedure for that machine. Do awareness training. People need to know what's going on in that area. Is there lockout tagout? What are those locks for, etc.? Do that today. It kind of helps you set goals, right? So do today is an easy step to get you started towards compliance. Portable fire extinguishers always makes the list. You block them, you put things in front of them, and many times workers are not visually inspecting them. So look into whether or not you have a fire prevention program in place. Most of you don't. So give us a call if you need to put together a fire prevention program. It requires that you assess what could cause a fire in your facility, making a list of those things, ignition sources, and taking a look at who would be responsible for keeping an eye on hazardous waste management, etc. Number 8, and this one is always in my list. It always makes it to the top 10, hazard communication. For those of you that are newer to safety, hazard communication means chemicals, handling chemicals. There is a whole Cal OSHA guide, and the cover looks like this in green. It's a beautiful guide. It kind of gives you step-by-step how to become compliant with the hazard communication regulation. So you're handling, all of us handle chemicals at our work sites. Even office workers have hand sanitizer. And because it's provided for industrial use, you should explain to them what those pictograms are all about, Prop 65 warnings, because they're part of this hazard communication program. You should have a chemical inventory. You should prohibit employees bringing chemicals to the site, etc. These are good tips for you guys. Oh, goodness. I don't know why portable ladders are all the way to number 9, but they always go to 7, 6, 9. They're always in the top 10. I'm actually revamping my portable ladder training. I already have a couple of sessions scheduled with many of my clients. And the reason is because this is such an innocuous type of tool, but it is more dangerous than any skill saw that you leave out there unattended. Ladders kill. And ask the person next to you right now if they know anyone who has been hurt on a ladder. And maybe you on this call, you've been hurt from working on a ladder. And it's always either broken bones. There's always some lasting health effects when you fall from a ladder. And if it doesn't kill you, it hurts you bad. So make sure that you train people and you authorize people. I hate seeing ladders laying around or set up against the wall or opened up inside an office or a training room, left there by the maintenance guy or by the team who just helped someone hang a decoration or whatever. And Christmas and Halloween brings those nightmares to the table where people that are not authorized to use a portable ladder use a portable ladder. So we need to make sure we authorize people, we have a ladder inventory, and we do training that is compliant with the regulation. It's a 7-step compliant training. So I'm revamping all of that, and we're getting the message out. Last but not least, emergency equipment, emergency eye wash, and emergency showers. So I run into the issue that most employers do not know when these things are required. And these things are required whenever the materials your workers are working with. You look into the safety data sheet. So there's some research associated with this. The chemicals they're working with, they're corrosive or injurious to the eyes or the skin and body of the person. And when that happens, the safety data sheet will give you first aid measures. And the first aid measure paragraph, make sure you're looking at an SDS, not a material safety data sheet. A material safety data sheet is older, in an older format. After 2012, material safety data sheet, for those of you that are like, what is that? That's a document that is specific to each of the chemicals in your facility. That safety data sheet has 16 sections, and number 4 and number 5 is fire prevention. Number 4 is first aid measures. It'll tell you, for example, if the worker needs to rinse the eyes for 15 minutes of continuous flow. Boom, bingo. That brought for you, the requirement to have an eye wash station. By the way, those wall-mounted saline bottles are not emergency eye wash. It will not give you a 15-minute flow to actually restore the pH of the eye. Sometimes I also find things such as, we get into packages for emergency response and they're not compliant. They're not emergency eye washes. They are not showers. And so take a look at what chemicals your workers are exposed to and get them the information they need, the safety data sheet and the emergency equipment they need. Further protecting the employees, another issue I see all the time is people with prescription glasses are not wearing safety glasses out there in the field. I need them on safety prescription glasses. Take a look at whether or not your company can and has the budget to provide this for workers, because you're not required. Okay, so please make sure that you understand that you're not required to provide safety glasses that have the prescription integrated into the lens. Nevertheless, it will help your compliance rate go up, because I see this often where workers are out there with the regular prescription glasses at job sites and construction sites or working with machinery and equipment. And then they end up in the hospital or emergency care or in urgent care because of debris in their eye. And you're wondering why. And it's because their own prescription glasses broke and you have a piece of the glass inside their eye. So there's a whole page. OSHA puts a whole page with the inspection number and the penalties and the names of the companies that have been cited all the way to June 2023. These are over 100,000 types of initial penalties. It's eye-opening. Take a look at the establishment name and it gives you an idea of whether or not they're your type of industry or the North American industry classification. Take a look at that and click on the blue inspection number and it'll take you to the OSHA site. And sometimes you'll see a description of what happened. And if you don't, at least it gives you a chance to take a look at the violations, because they will list them per the sections that the company violated. This top 10 most frequently cited standard web page gives you from 2015 to 22, and it's got great information that you can follow through after I'm done today, because guess what? It's 12 o'clock. I know your bellies are rumbling. You got to go get lunch. And I appreciate the time you took to be here today. Woof, we really flew through all of this information. So we went through four things that you want to do today to get your crews together and prevent exposure to smoke during the fires. And then we talked about how important it is to take a look at those top 10 most cited. My English is bad right now. So once again, guys, thank you for being here today. I'll see you next month. If you have not subscribed to my newsletter, please do. Aside from sending you my first of the month. So on the first of the month, I send my written newsletter out, one page only with some safety tip. I also send you safety updates like the issue with the wildfire smoke. Veronica, I appreciate your help and everyone on this call, and I will stay a few minutes for questions.
Yes, we do actually have two questions. Thank you so much, Alda. So one we do have from Carol in the chat. It says, how does the workplace violence regulation apply for employers who have staff working exclusively on site at client locations? And then we have a second question after that.
Exclusively at client locations. Well, an analysis needs to be done. So that means you're sending workers out to different locations, so different companies. Well, there's even bigger exposure there because you have no control over what goes on at those clients' locations. So it is an interesting setup, but nevertheless, your policy needs to include, okay, when did you actually, so the first step that what I would do for you, because this does require an in-depth talk. The first thing, I'm going to give you one tip. Each client location should have a workplace violence prevention policy in place. Request a copy of it. That means when your employee is going to their location, they are protected by the first layer. That client's policy is already in place. And so the next step would be whether or not he or she was included in the training. If not, why not? What are some of the issues at each of that client's location? It's different if we're talking about, let's say, healthcare and worker is going to residences. So now you have to develop your own policies because obviously the homes of residents are not going to have a policy in place. So your policy would deal with that. But yes, even for you, if you don't have a physical location for all of your employees, they're going to different clients' locations, you have to comply with this regulation. Next question.
Yes, next question we had from Alex. It says, is a step stool considered a portable ladder? I'm thinking of the small ones that are round with two small steps that are on spring wheels that compress when weight is placed on it.
They're more of a self-supporting type of platform or working platform. Get rid of them if you can, if you can, because they're not considered a portable ladder. They're step stool. But because you're gaining some height and you're allowed to step at the top, I see a lot of ankle injuries from the use of this step stool. So what I do when I see a lot of step stools at my facilities is the first thing is I ask, why do they use it? Why do they have to have it here so immediately available? I get rid of a couple of them, and workers don't like me many times when I get rid of their step stools. Okay, it's like, look for better solutions. So I'll give you an example. The first thing is many times they're old, raggedy, and they're falling apart. Get rid of them. Please get rid of them. And then look at better options. When you have the need of a step stool, that tells me immediately they need to be doing work at height. And because it's a fixed height, you could take a look into better tools, not a step stool, because those are easy to fall off and break a knee, break an ankle, break a leg, basically. So you need either a podium ladder or some a small industrial stairs with handrails, you know, that are not very heavy and very bulky. And maybe even beyond going through all of this analysis, can you bring those materials that they need to reach for lower? Boom, you get rid of the stools. Next, please.
Yes, next question we have from Tristan. Are you aware if OSHA has cited on indoor illness yet? Our DO seems to think that all indoor facilities must have a policy in case their AC fails in the summer. And then there's a second question after that.
You know what? You don't have to have a policy that it is compliant with 3396 for indoor heat illness in case the AC fails. Why? Because number one, that's not the way we work. Okay, so here is the thing. If your facilities are known for having broken AC all the time and you put your workers through suffering the entire summer because it's an issue that repeats and is just the norm that you don't have good indoor conditions of work, then we're doing it all wrong. So right there from there, it's like, what are we doing? It's an indoor facility. We have an HVAC system. It's just not working. Fix it. And have a system to allocate funds prior to the summer so that the systems are up and working. You do not need to worry about a policy, right? Now, just remember, the intent of the regulation is for those workers where they're exposed to indoor heat because of the nature of the business they do. I'm talking processes that produce heat. I'm talking about foundries, breweries, you name it. I'm not talking about office work where the AC breaks. There, we're just saying, hey, don't be cheap, fix the AC, right? You do not need to have a policy in case the AC breaks off apart. How do you say? My English is gone. Go ahead, next question.
Next question is, what's going to happen to the CPP regulation? And that's the General Industry Safety Order 3205. I believe that's the COVID, right? COVID prevention and enforcement after February 3rd, 2025, when the regulation expires.
So the regulation expires, and maybe asking OSHA directly would be a better thing than I can answer. But what I have seen when these things occur is that because the regulation was an emergency regulation and it's gone, it doesn't mean you wouldn't be potentially cited. So remember, it's all about the health of the workers. So during flu season, we see a lot of COVID issues too. So you should have a policy. And that's why when I was tackling that in my presentation today, I was telling you guys that the only reason the COVID and the ATD, which stands for aerosol transmissible disease standard, made it to the top 10 in 2020, in 2021, 2020 and 2021, is because the pandemic was there and everybody was worried, and a lot of complaints, all of that, a lot of complaints, a lot of issues where workers would pick up the phone and call OSHA, that type of thing. Don't see it at, oh, it's gone, I don't have to worry about it. No, these issues with the flu and communicable diseases continue to happen. So what I do with my clients is, okay, what issues do you have? And they say, well, we do have COVID, we do have issues with the flu because we take care of 2 shelter centers, and I have employees there that take care of homeless people. Whatever the issues are, you write it down and you go, okay, so I need to develop a policy for these 3 communicable diseases. And I have to actually, just like with COVID, distancing and washing your hands and giving time to do all of that. So if you already had a policy that was beautifully put together, that doesn't mean it just goes away. Just update it. You maybe can incorporate it into your communicable disease prevention or infection prevention policies, and that's it. But it doesn't go away entirely, because in the future, after February 3rd, if 2 workers say, hey, now that this thing is not enforceable, now they don't care and they make us work even if we're sick, and people are sneezing and they're saying, I have COVID, but I don't know, they made me come to work. You're going to have a complaint in your hands, and OSHA is going to show up and they're going to ask you, what are you doing to prevent this from spreading? And you're like, well, the regulation went away. That's not a good answer. Another question?
Yes, one last question. It says, it's from Jose. Hello, with the current fires, I noticed TV reporters are using paper masks when reporting from the field. Are those safe to use during active fires?
See, the issue here is, number 1, what's the quality of air where they're at? So I started my 4-step guide today saying, make sure that you know how the air quality is at that particular location. If it's between 151 and 500, a paper mask, as long as it's NIOSH certified, is okay. And
Yeah, we just keeping in mind, like Simone mentioned in the chat, ideally folks who wear respirators would be fit tested, right? So that's the one thing. So if it's, TV reporters, their employers should be doing fit testing and making sure that it's the appropriate respirator for them to use for that condition that they're being asked to work in, right? So knowing, again, monitoring the air quality, knowing what it is at that moment. So definitely, yeah, N95 is better than nothing, but ideally we'd have, a half mask or something, whatever is most protective for that scenario.
higher assigned protection factor, no doubt. And just remember that the job that a person does, when you hire someone, you are making a list of the activities, the tasks, work activities that they're going to do, and then you train them in the hazards associated with those tasks. So whenever reporters are being hired, one of the issues is responding to issues where emergencies are present and they may need to wear protective equipment, so they're fitted prior to being out there, right? So these are things, it would be very rare for these types of occupations not to be prepared, but yeah, an N95 is better than nothing. And yes, should they be on a half mask? Yes, but N95s are still a-okay when it's the PM 2.5 air quality index is from 151 all the way to 500.
Great. So those are all of the questions we have in the chat. We did have some folks who shared their email with us to sign up for your newsletter, Alba. So I'll be sharing those emails. We have a lot of interest here. So we just want to thank you all. And this recording will be available on our website and as well as on our YouTube channel. Actually, we have one more question. Should we document that N95s are provided for comfort use?
Not comfort use. And Simone is right. You cannot say comfort use is voluntary use. That's how you document it. And that's how you strongly tell them you're not required to, but you're strongly recommended to use it. This is what OSHA say. We strongly, and the word is encourage. The word encouraging the worker is in the regulation. We strongly encourage you to use them because the air quality is poor. We are not at a point where OSHA requires for you to be fit tested with a better respirator. That's why we call them voluntary use. And you have to add to that the actual Appendix D of the regulation, which whenever they wear a respirator on a voluntary basis, you are informing them with a one-page document that this is not a protect me against all kinds of matter, because this is a particulate filter. The material, many of you say, is a paper mask. Why? Because it's an actual filter material, but it's just for particulate. And it actually also has limits as to the size of particulate that it can actually filter, meaning you are using your lungs as the powering mechanism to filter the air and make it cleaner when as you inhale it. You guys are fantastic. Thank you for the questions. Thank you for the participation, for the notes, for the chat. Thank you, Veronica. I appreciate your time. I'll see you next month, and stay safe.
Thank you so much, Elba, and thank you all for participating today.
Thank you.